This is the Brave New Coin Crypto Conversation, hosted by Andy Pickering.
Hi everyone, Andy Pickering here. I'm your host and welcome to the Crypto Conversation, a Brave New Coin podcast where we talk to the people building the future in the Bitcoin, blockchain and cryptocurrency space. Today's episode is a little bit different. I've got Trent McConaghy on the show. Trent is the founder of Ocean Protocol, but today we're going to talk about the coronavirus, COVID-19. We're going to talk about a paper that Trent has published that uses modeling to look at when hospital capacity is overwhelmed, and he has modeled this out looking specifically at Berlin in Germany and Washington State in USA. And yes, the results don't look good. So that is what we are talking about today. Before we get started, I want to let you know that we have a sponsor. Yes, this episode is brought to you by Nexo, the only provider offering instant crypto credit lines, which let you use digital assets as collateral to get cash in more than 45 different fiat currencies and stablecoins. In order to secure a loan with Nexo, you must first deposit collateral that will be used as a security deposit to repay the loan if you fail to do so. The cryptocurrencies currently available to serve as collateral are Bitcoin, Ether, Ripple, Litecoin, the Nexo token, Binance Coin, Stellar, and EOS. And new collateral options are being added all the time. Nexo also offers the ability to earn 8% daily compounding interest on your digital assets, euros, US dollars, and Great British pounds. Now, this is up to 130x what the traditional banks offer. And what's more, interest is paid out daily, and you can add or withdraw funds at any time. Nexo launched in 2018, and since then, the company has established itself as the world's leading crypto lending service. So far, they have processed more than 1.5 billion for more than 550,000 users on their platform. And the company has 100 million in insurance on all custodial assets provided by the leading audited custodian BitGo. So don't worry, your assets are safe when using Nexo. Get started at nexo.io. My guest today is Trent McConaghy. Trent is an AI and blockchain expert, and Trent is the founder of Ocean Protocol, a decentralized data marketplace. Welcome to the show, Trent.
Thanks for having me.
Now, the funny thing about this podcast, Trent, is your people, they reached out to me back in January about coming on the show. And so we scheduled this podcast or this interview for today. And originally, when we were talking back in January, we were going to talk about data rights, privacy, Ocean Protocol, all of that stuff. But in the 6 weeks or so since that time, the COVID-19 coronavirus has spread all over the world. And you've been watching this closely, so much so that you have written a data-driven essay on the COVID-19 coronavirus. Specifically, you ask the question in that essay, how long is it before hospital capacity gets overwhelmed, at which point the death rate jumps? And I want to talk about that essay very soon. And I think people know that my opinions aren't necessarily to be trusted here. I'm just a podcaster, but you've published this essay, and anyone obviously can publish an essay, but there's this perception that a lot of crypto people, a lot of blockchain people have overnight turned themselves into experts in virology. So I think just to put this in context, first off, I think we need to understand a little bit about your background and your credentials and why anyone should listen to you as an individual. So why don't you just explain a little bit about yourself and your background?
I guess I'll describe my background and then also my sort of philosophy around even writing anything on this. I grew up on a farm, shoveling pig manure, playing hockey, and programming computers, actually, on cold winter nights. Studied electrical engineering and computer science in university, worked for National Defense in Canada, and then started a company using AI for designing computer chips. A lot of the work that I did was in modeling dynamical systems that basically change over time, and accounting for statistical variation and accounting for extreme nonlinearities. I was doing this in the application to computer chips for helping basically to drive Moore's law. So the users of the technology were companies and are continuing to this day. 19 of the top 20 semiconductor companies, or probably all 20 by now even, have been customers, including Sony, Qualcomm, Apple, TSMC, all of these. But that said, I'm not going to claim to be an expert at all in the spread of epidemics directly. I'm not an expert in other fields, or medicine or anything like that. Absolutely not. I want to make that very clear. I felt myself as a citizen and an individual and a human with a family. I had some big questions about, where is this thing headed? How much time do we have? And so on. Many questions were being answered by a lot of great people out there doing really great work. People who are pros in modeling these things in various ways, trying to understand what the death rate is depending on various factors, looking at the spread, trying to model what the actual true number of cases are, all of this. And I thought that was really great. But what I saw was that no one had really asked in a really, really deep way yet, when does hospital capacity get overwhelmed? Can there be, really nice models on that, or even very basic models, right? There are true experts in modeling epidemics. I'm not one of them. I just used some fairly simple math tools to answer a specific question. Hopefully the true experts will take up this question and answer it even better. In the world of blockchain, you learn to become a skeptic at what your leaders are saying, things like fake news, all of that. While the scientists, they have been very proactive, a lot of the decision making at the government level seems to be moving very slowly and their incentives are misaligned with those of the citizen safety. They want to make it look calm and so on. Because of that, there was another driver where it's like, okay, I just feel like I have to get this out.
Yes, indeed, Trent, and I very much agree with that. And for me, one of the first things that I read about the virus that really resonated with me was back at the last week of January when Nicholas Nassim Taleb, who of course is the author of books like Black Swan, Anti-Fragile, and Skin in the Game, and these are very popular books within the crypto community, and I've talked about the paper that he wrote a couple of times on the podcast, but that one pager was called How to React to Pandemics, and he made it's only one page, but he made a very good case, and of course it's really common sense, which is another way of explaining Taleb's philosophies on these things. But, the idea is that when confronted by a global pandemic, the only sane or sensible response is to immediately put all of your resources into containment, with the idea being that if you are going to panic, as Taleb says, it's better to panic early rather than have to panic late. And even since then, I think there's still this weird disconnect a little bit, Trent, between, people on the one side who are just saying, this is just a mild flu, keep calm and carry on. And really until yesterday, that has been President Trump's position. And then on the other side, and we notice this on crypto Twitter, that people like Taleb, people like yourself, people like Baliji and Ryan from Masari, who have really been sounding the alarm. What have you been observing, and what do you think about that disconnect?
There's certainly a disconnect. I think overall, the way that I frame it, there's things that I can control, things that I can't. The first thing that I've been doing, and I've been, watching this very closely for a long time now, is just gathering information, trying to gather data, right? So, whenever I'm reading articles, I'm trying to see what's the data. And, how Ryan Selkis put it too, there's certain people you can trust. So, and he pointed me in some of his writings and whatnot, and I iterated with him too. We've known each other a long time on, pointing me to more resources, more people. And I have friends sort of from other communities related to crypto, things like, the X Prize community, exponential community, these sorts of communities that think about this too, the AI community, right? So using that network to try to gather some data, and even, my colleagues in Ocean and stuff too, in particular Bruce, we've really been talking about this and thinking about this a lot, not only for ourselves, but for guiding our employees around us and so on. It starts with understanding and knowledge and knowing that things are going to be uncertain, but in the face of uncertainty, what do you do? And, this goes back to my, partly Nassim Taleb, but even, what I did in my previous company, which was, modeling what the yield of a chip might be. Is it 1 in a billion chance of failure or 1.1 in a billion? So really long tail stuff, right? And that affects, the yield of a chip overall then, instead of just one memory circuit within, is the yield going to be 95% or 1%? So you actually can model tails to a degree. But for whatever you can't model, you should be trying to bound the downside at the very least. And that's very much a Nicholas Nassim Taleb thing. And that's sort of the way that I've been approaching the actions on all of this, is bounding the downside, right? Bounding the downside, starting super local with myself and my family, and then with my colleagues around me, and then beyond, with Twitter and the broader world, seeing what I can do, where I can take action, where I can help, and making sure that I'm not getting in the way or adding to noise wherever I can. That was the first thing, was learning, and then seeing, if there are gaps. Like I mentioned, I did see a gap that I had a burning question that I was asking myself, so I set out to answer it. It's a model, no more, no less. Even since it was published, it was too optimistic. I mentioned in the article even that it could be too optimistic. It has come to pass that it is, but it was least useful. And I think the simple act of asking the question was really, really, really important, right? If you do a PhD, the very first thing you do is you try to find a really interesting research question. And the world's greatest researchers are the ones who have a nose for great questions, right? So that's the question I sat down with, something very specific. When does hospital capacity get overwhelmed in America and in Germany?
Okay, so that is the title of your essay. So let's talk about that then, Trent. So, and just again, putting this in context, so we've established that you are a data scientist or a data researcher, and you know exponential growth, and because that's really how viruses work. And when I woke up today, the World Health Organization has finally officially declared COVID-19 coronavirus situation a global pandemic. And I think, a lot of people have obviously thought that would happen for a little while, but here we are. Yeah, let's get into your essay. So the essay, you've published this on Medium, and I think you published it almost a week ago now. So, and yes, it's called When Does Hospital Capacity Get Overwhelmed? And you've used a couple of different locations in the USA and Germany specifically for your modeling. What's the background to this? So the idea here is, because we see people talk about this idea of flattening the curve, right? So that's really important. So the idea there is that in a global pandemic, a lot of people are going to get the virus because it spreads exponentially and it's very viral. That's what happens. So the idea is if we can slow that spread down by social distancing and washing our hands and all that kind of stuff, we can try and flatten the load on hospital capacities so that we don't end up in a situation like what happened in Wuhan, where society effectively broke down for a little while there because the hospital capacity was just absolutely overwhelmed. So that's the context here, I think, Trent. So yeah, pick up the story. What are you trying to show with your essay here?
Sure. So, yes, and around the same time I published the post, it was actually March 8th, so just 3 days ago now, 2.5 days ago. There had been already an image and the meme already flattened the curve, which is an awesome start, right? But back then, it didn't make a distinction on, why would you flatten it? It's still, if you look at it, it's two different curves with the same volume under the curve. So what's the benefit of flattening? And it kind of talked a bit about that. It helps with capacity, but it never really put that into the image itself, never really modeled it, never gave real numbers around it very well, right? And so to me, I said, okay, well, what does this actually mean? How can we get at this with a number? Can, more data on this, more models help to spur action? And so I started thinking about what would be a proxy for this, proxy for hospital capacity. And then also to just, maybe make a more refined visual model of what this looks like. Because flattening the curve, people aren't really used to think in terms of distributions, right? So what might that look like? And so two things. A good proxy for hospital capacity is simply number of hospital beds, which is something that can be counted fairly readily, although there's actually complications there too, and that's not the full picture, but that's the start. And then you can also then relate that to simply the number of people in serious condition. So once the number of people in a serious condition surpass the number of beds that are available for that, then that's where we have the real problems, right? That's the first thing. But then, when it means real problems, when it means capacity, what does this actually mean? And the core thing there is that the mortality rate, the death rate spikes, right? Because, there's just not capacity in the system. And we've been starting to see that in the last couple of days in Italy. We saw that before in Wuhan, right? whenever you're trying to answer a research question, you want to make it as specific as possible. You want to search for the most specific numbers you can and so on. And then once you've got that very specific model, then you can get a bit more generalized here and there and here and there, right? Yeah, that was really where it started. I had seen the initial flatten the curve picture. It wasn't precise enough to me. So, I have this new picture which shows 3 curves, one below the other. The first curve, they're all, as a function of time. The first curve is the number of beds needed, and the beds available. The beds available is flat. The beds needed is going up over time, at least to start with. But of course, once the beds needed surpasses the number available, that's when the mortality rate spikes, right? So that's the second curve. It's just this, it goes from a low rate, which could be, say, 0.5%, like we've seen in South Korea and so on, up to, 5% or more, which is roughly the numbers that we're seeing in Italy or Iran right now. And so that's a 10x, right? Because just basically the people that need the hospital help aren't able to get it. So that's the second part of the plot. And then the third is, I guess I already said, once the death rate jumps because there isn't the capacity, then obviously the number of deaths jumps over time, right? And it's going to keep going, rising very quickly until there is an intervention, right? And so the intervention can be, there's 2 main interventions, right? There's the intervention to prevent the infections in the first place. This is what's now people are calling social distancing. And there's a whole bunch of tactics around that. The main ones, stay home, work from home, all that, but many other things that many smart people have written about with advice. The second thing is once you get infected, then treatment, right? From professionals, ideally medical professionals. So these are the main things. That's basically the image in then, right? So as number of beds exceeded the number available, death rate jumps, and then the number of deaths jumps. And it's going to keep, it rises over time. And it doesn't stop rising until you've run out of people, which hopefully isn't the case, or until there is much stronger interventions to address these, right?
Yes, that is right. So, and in your essay, you've picked 2 particular locations, right? So in the US, you've picked the Washington State, which is the hot spot, shall we say, in the US, and the other location is Berlin in Germany, which I think is where you're based, Trent. Now, and obviously, a link to your essay will be in the show notes, listeners. But yeah, so talk me through specifically the modelling for these 2 locations and what you think is going to happen and how soon and how many hospital beds there are in these 2 particular locations, Trent.
Yeah, sure. So before I get to the model, maybe there's a much simpler way for everyone to think about this overall.
Sure.
That is, we see what's going on in Italy. It's close, right?
Yeah.
And there's a whole bunch of different studies that have come out in the last couple of days, especially, that show that Germany itself is about 7 to 11 days behind Italy. And there's report after report after report on that, right? And Italy was overwhelmed about 2 days ago. So what does that mean? It means that Germany is about 5 to 9 days before its own health system is overloaded, right? It could be less than a week from now, and we will be having the same news reports we were getting from Italy already 2 days ago, and it's getting worse every day.
So Trent, explain what that means, because unless you actually dig into some of the tweet threads on Twitter from some of the doctors on the ground in Italy, you won't necessarily get the real picture of what's happening in Italy. So just explain what's actually happening, what you mean by overwhelmed.
Yeah, overwhelmed means basically there are so many people that get infected that when they arrive, that basically they start showing symptoms. And if the symptoms are mild, then they can stay home and stuff. But if they start to get worse, then they call the doctor or some hotline. And then the hotline will say, yeah, this sounds serious, you should come in. They come in, or maybe they just come in anyway. They come in and then, they're coming to the ER at the hospital or some special tent or whatever that's set up. Once they get there, there are, say, maybe a total of, in a given place, I'll just make a number up, say 10 beds that have appropriate equipment, right? Ventilators, etc., for the 10 cases that are the most serious. But there are 100 people there that need them, right? That's the problem. And it went from, 10 beds with 0 people needing them. And it was kind of like that in Italy. After they cleared out things, they had basically 0. And then the cases started to trickle in. It went from 0 to 1 to 2 to 4 to 8 to 16 to 32 to 64 and so on, right? It just kept doubling every 2-3 days, right? And so now they're completely overwhelmed, and they are having to, and basically every person that does get treatment, they have a much higher survival rate, and if they don't get treatment, then they have a much higher death rate, right? It's simple as that. So now triage is becoming a much more common thing, and it's super sad, right?
That's right. And Trent, explain what triage means. People hear the word, but people don't know what it means. It's a wartime term, really. So explain what triage means.
It's basically, the people on the ground, the medical staff at the hospital have to basically choose who gets to have the bed or not. And they are having to come up with criteria on the fly. And the criteria that they seem to be using are around, what is this person's chance of making it? What sort of is their expected future contribution to society too, for example? So generally they are saying, if you are over some threshold of age, or if you have had a past history of cancer or of pneumonia or other things, then we're not going to treat you because you have a much lower chance of making it through anyway. So we're going to focus on the cases that have the highest chance of getting through.
So that's already the situation in northern Italy.
Yeah, northern Italy, and before that, Iran. Before that, Wuhan. Right.
Yeah.
The thing is, also, it's not going to slow down, and for a while here, right? I saw a tweet today that one way to characterize this, it's sort of like a bomb went off in northern Italy. But instead of just dissipating and things calming down, it's sort of like it's getting stronger and stronger every day, right? Like growing exponentially. Now, fortunately, Italy did shut down, basically quarantine, people, such that they're not supposed to leave their houses and so on. Now, that said, there is an incubation period from the time that you get infected to the time that you start showing symptoms and need help. The average is somewhere between 5 and 7 days. So it can be as low as 1 or 2 days. It can be as high as, I think, 21 days is the outlier. But what that means is, if Italy shut down, I forget the date that Italy had the quarantine, let's say 4 days ago, that still means that there's still going to be a whole bunch of cases coming into Italy in the next 2 days, 4 days, even 6 days, 8 days, and so on, right? So that's actually worrisome. The good thing is, though, with these measures, this is a social distancing measure, right, the quarantine. This is super effective, right? This is what China did. Initially in Wuhan, and then 1 day later with a whole bunch of other cities. And it stopped it in its tracks, basically, right? The number of infections really, really greatly reduced. It was basically just then between, people that were living in the same home. Someone that was infected went to the next, and maybe some other small stuff, but that was the main stuff, right?
So social distancing is effective, but obviously, Western countries reluctant to try and put any measures anywhere close to what was effective in Wuhan. That is happening now in Italy, yes. But Berlin is obviously one of the locations that you have modelled out. So you think, according to the model, Berlin will go over capacity sometime in the first week of April, I think. So what's happening on the ground in Berlin in terms of social distancing? Is that just being done at an individual level at the moment? What's likely to happen from Angela Merkel? What's she saying at the moment?
Yeah, so overall, I'll mention the initial model was too optimistic. I had a weekly growth rate. Back then, we didn't have as good numbers for the growth of Germany, so the weekly growth rate was too low. I remodeled it, and I see that it's now 7.5x. I've updated the blog accordingly, 7.5x per week, which is about 1.33x per day, which is actually in line with other people's estimates. Also, the number of infected but not reported was higher, and there's an even bigger capacity constraint, and that is the number of ventilators. So even though you might have beds, ventilators are in short supply, and these are basically, when you lay down, you put this oxygen mask on, and then you've got a machine that sort of acts like an artificial lung. These are in short supply, as well as the staff that is trained to run them. I just want to mention that up front because I don't want people to think that, it's April 3rd because of the model. It's actually looks like sooner. And once you have this more, less optimistic model, more realistic, it's much more in line with what's going on in Italy then, which is we basically here in Berlin, from today, we have 5 to 9 days where the healthcare system is overwhelmed, according to the, updated model. To your question of what is being done here in Germany, maybe I'll just to give you a feel. In USA, there was massive denial. Everyone was kind of looking there and seeing what the president was saying, and in massive denial, and thinking, like, wow, they're so screwed. But then I look in Germany, and if you think about what's actually happening, it's not much different. It has been maddening, right? There has been more measures taken in the last couple of days, but a lot of things, like if we stopped just today, like had the basically quarantine stopped today, then we would have still 6 days of incubations, right? And it's about that exact day that the healthcare system is overwhelmed already, right? So we're already way behind the curve, right? What has Germany done? So in the last couple of days, they have made it where people can stay home for a week, basically free sick leave. They have not closed the schools here in Berlin yet. There's been a couple schools closed, but generally they haven't. And this is actually really a problem because if parents take away their kids from school for more than 3 days, then social workers can come along and take your kids away if you don't have a good reason. The German system really likes to stick to rules, so this is certainly a challenge. So other measures, though, the stores themselves are all open. Everything is basically still open. People seem to largely be complacent, which is maddening. I was walking around today with a mask, and people stared at me like a space alien, and there was no one else with masks. Right, and latex gloves and so on. And I've been working from home now for a week and a half. Fortunately, we're a company that is easy to implement remote work. Right, with what we do, that's actually made a big difference.
That's a great point, Trent. And so here at Brave New Coin, and look, we're in Auckland, New Zealand, and here in New Zealand, I think we have around 5 confirmed cases in the country at the moment, but probably on balance, New Zealand would be one of the better places to be across the next few months, I think. The US, and look, I'm always a little bit reluctant to speak too much to what's happening in America because obviously, we're not there and this is just speculation. But it feels like the US, they do have some unique factors that could work against them. They have this health system and, Trump hasn't been helping in terms of trying to get people ready for what might be coming. And then they have this massive service industry where the people that tend to work in that industry might not necessarily have health insurance and are disincentivized to stay home. And what happens if all those people get the virus and they're still working for the first 10 days that they have it? And yeah, it's a strange situation.
Yeah, strange is one word, but I think, ultimately it's all about outcome, right? So what are the actions that can be done as individuals, as business owners, as governments in order to keep your people safe, in order to prevent, to bound the downside, right? And this is bounding the downside in terms of citizens' health, in terms of the livelihood of the citizens and of the nation, and more. But that's probably a good summary, right? So while I watch what's going on in the U.S., I can't control it that much, of course. I have friends in the U.S., including in Washington State, that I've been iterating with a lot, right? That's certainly a challenge for them. But once again, what are the things that I can help move the needle on, right? It comes down to, first of all, getting educated, and then protecting myself and my family and people around me. And then beyond that, though, trying to see if there's other sort of new ideas, new thinking, new modeling that I can add to the world, right? Based on, some of my skills, my background, some of the tools may be available. With Ocean itself, we have asked ourselves, how can Ocean help with this too? And right now, Ocean, it could be amazingly helpful at some point. It doesn't quite have the right characteristics to be helpful right now yet, I'll be honest, right? It's getting there, but it's not there yet. So in my essay, I don't talk about that at all because, at the end of the day, what we want to do is help people, right? And, for any marketers out there in the world at all, please don't use this as a marketing opportunity to promote your project. Instead, let's get through this together as a civilization, right? And do what it takes to get through. And we will, of course, the mortality rate isn't 90% or something. It's going to be painful. And the second order effect might end up being bigger than the first order effect, the second order effect on the economy, right? These first few dominoes, these are much bigger dominoes than Bear Stearns or Lehman Brothers failing, right? It's another thing that, a question mark I have, but also I'm not an expert. So I'm not going to try to predict what's going to happen there. Instead, I'm going to focus on the things that I can control.
Yeah, look, that's another great point. To bring it back to Nassim, Nassim, of course, he literally wrote the book on this. He wrote the book Black Swan, and it has become clear that COVID-19 is a black swan. And again, look, we're not experts here, and no one can really predict what is going to happen, but you sort of alluded to it. It's really that definition of a black swan is what happens when one single unexpected event can have cascading ramifications across a myriad of interconnected systems. And in today's hyper-connected world, all these systems, supply chains, everything is dependent on each other. And if those systems start to break down when they're impacted by some kind of black swan event like COVID-19, it is going to be a bumpy ride ahead, I think.
Yeah, for sure. And I mean, I can add to that. So actually, after I wrote that first blog post, it was actually on modeling the beds, when does hospital capacity get exceeded? I actually had a whole big section on sort of some of my thoughts on what to do about this. But I realized that, that wasn't the place really, because I really wanted to just answer this one question. So I moved that into a second blog post that I posted within a day of the first one on what we can do about coronavirus, right? The opening paragraph starts with basically talking about the black swan, and black swans, they are super high impact events that are improbable, right? But in this case, it remains a super high impact event, but it's gone from highly unlikely to likely to happening. Right? And no one has perfect models of how it will unfold exactly, but we can identify these worst case scenarios and we can model it to a degree, right? Nassim Taleb talked about that, how hard it was to model rare events. I built a career on this, right? So you can actually model with higher fidelity. Maybe it's 1 in a billion chance, maybe it's 1.1 in a billion, but we don't need to throw up our arms. Maybe it's 1 in 10,000. That's actually, some useful tools there, right? But then your actions, what you do remains the same, which was the advice that he gave, which is the most rational thing we can do is bound the downside, right? And we can bound the downside. I can't emphasize this enough. This is the questions we need to be asking. How do we bound the downside? How do we minimize the chance of getting infected in the first place? How do we minimize the downside if we do get infected? How do we bound other downsides, including financial, right? We can ask that as individuals. We can ask that as governments. And also seeing that governments are going to get overwhelmed with healthcare capacity and so on, then how can we help? As civic-minded individuals, I've been asking this question too, right? The wonderful thing about the web is that there's a lot of great answers, and you kind of sometimes have to separate the wheat from the chaff. Once again, you just have to kind of watch how your brain is working, and then go look at the data. It starts with the data, and also proxy with individuals that you trust their opinions, the time that they've taken, and then go from there, right?
Yeah, that's really nicely said, Trent. And look, I'll put a link in the show notes as well to that second essay of yours, because you've put there is a lot of good advice in there, and it's a calm and rational piece as I would expect. And again, you're right. There is a lot of calm and sensible advice out there on the internet. It is just a matter of separating the wheat from the chaff and the signal from the noise. Yeah, I suppose we should go to a quick break, Trent, and then we'll come back and we'll finish off and just get some closing thoughts on COVID-19. Back in 1 second.
Whether you're an enterprise fund manager or a retail trader, buying and selling cryptocurrencies successfully requires price discovery you can rely on. Brave New Coin's liquid indices provide trusted US dollar prices for Bitcoin, Ethereum, and Ripple. Featuring end-of-day or intraday outputs, you can count on the BLX, ELX, and XRPLX for accurate US dollar pricing for smart contract oracles, settlement price discovery, net asset valuation, and performance analysis. Visit bravenewcoin.com to find out more.
You mentioned Ryan Selkis a couple of times, and he wrote a piece, Moon Times Are Over, something like that. It was quite a long piece. It was a blog on Medium, and in that piece he quoted you at length, and he talked about your modelling, and he used that as a good example of the fairly dire situation that the world faces. But have you read the rest of Ryan's piece there? It's a speculative piece, but he talks a lot about what he sees as the real downside risk to the economy and to the markets, to the stock market, and also to the crypto markets. But yeah, what did you think of that piece?
Overall, I think it was very good, actually. I think it's hard to speculate on where things will go markets-wise in 2 months, 4 months, 6 months. Obviously, there's going to be bear stuff happening. Obviously, probably, when a lot more negative things happen in America, this will drive down sentiment in America in a huge way. But I don't want to bother predicting too much more beyond that. I know that it's going to be bad. I have various hypotheses. I think the thing that matters the most is for people to focus on getting safe now. Right? And for governments to focus on getting safe now. And the more people focus on that right now, the quicker that the world will turn a new leaf, right? That we will see rays of sunshine, lights at the end of the tunnel, all that. So if it's all right, I'd prefer that we focus this conversation on actual actions that people can be taking.
I think that's a very, very sensible suggestion, Trent. So 2 things from me then. So I would say, the number one point to keep in mind is, I think we will get through this, but the only way that we can get through with the best possible outcomes is for individuals, companies, corporations, and governments all to start to take specific actions to help each other. So let's talk about that then, Trent.
Yeah, sure. So from my perspective, I've been tracking a lot of different advice and gathering as much as I can and whatnot, right? Obviously, there's a bunch of things out there that are super not helpful, and other people have talked about this at length too. Things like saying it's just the flu. It's not a flu even, actually. It happens to be from that family, but it's like humans are from the mammals family, just like mice, right? We're very different creatures. So it's very useful to understand that there's a lot of not useful memes out there. Also, a lot of people are not understanding exponentials. So they would, even Trump and others have said, oh, there's only 10 deaths, there's only 100 deaths. Compare that to the regular flu. Well, the thing is, regular flu doesn't, double every few days with more and more deaths and keep happening for 30 days, 60 days, 90 days or more, right? So this is totally the wrong advice to people. Exponentials are funny things. They're small until they're not.
Yeah, just on that, Trent, this is such a cliche to say, particularly to people such as yourself who live and breathe this stuff. But, for people who don't really know what exponential growth is, the example I always use is the rice and the chessboard problem, which simply says if you take a chessboard, there are 64 squares on a chessboard. If you place a grain of rice on the first square, 2 grains of rice on the second, 4 on the third, and so on, and you simply just double on each square. The question here is how many grains of rice are on the chessboard at the finish? And the answer, the number is so big you can't say it. There are about 20 different particular numbers, but that just doesn't make sense to our linear thinking minds. Humans are not wired to understand exponential numbers.
Exactly, and I've been actually racking my brain in the last couple of days to help explain this to people in other ways, in ways that they're familiar with. For the crypto crowd, a good one is just thinking about the price of Bitcoin, right? Like, if you go back to probably most of your, or a bunch of your crowd might remember, it was just on the heels of this person spending, I believe it was 1 million Bitcoins to get a pizza, right?
10,000 Bitcoins.
10,000, okay, right? Yeah, so that was, it feels so crazy now, but that's simply because the price of Bitcoin has risen so exponentially, right? And even, going back, I recall early 2013, it was $100. So even from then, I remember in early 2013 thinking about it, it's like, yeah, my logic told me that it's going to be worth, $10,000 plus, right? But it was hard to believe, right? And then within 1 year from that, it went to 1,000, and now it's at 10,000. And many people will say, it's going to hit 100,000, it's going to hit 1 million, and so on. And part of your brain is like, how could it possibly be another 100x or whatever, right? But at the same time, you just have to go and look at history. So you have to kind of let your logical, rational brain overrule your gut feeling. The gut feelings don't help you very much that way, right? Your gut feeling is to run away from, your gut feelings is from evolution teaching you how to run away from lions, right? But your logic and your math is what will teach you about these exponentials are really powerful, right? So, watching the rise of Bitcoin is a good one. Another one is simply Moore's Law, which is where I spent time, right? Every 18 months, the area taken up by a transistor divides by 2, right? And that's why, what was a $25 million Cray supercomputer in 1985 is now living inside your pocket, inside your phone, right? So that's, the magic of exponentials at work, right? We could go on and on, but it's really important to understand because I think that's one of the psychological things. There's another big psychological thing here too, and that is it feels so crazy, right? That so many people around us, or even us, are going to get this thing. More than a negligible fraction of us are going to have it serious or maybe even die. That feels insane, right? But you actually have to realize that the status quo of right now is going away, right? For at least the next month or 2 or 3. It is going to be, I'm training my brain to brace for when the quarantine happens in Berlin. Ideally it happens tomorrow. It's not going to happen because of the way the government officials work, but it's going to happen in 3 days, a week, 2 weeks, whatever it is, right? Or if not, there will be absolute decimation, right? So it's really important. Your brain is going to push back, right, on this stuff because it goes against intuition, and you really have to try to, ram it through with logic and repeating it to yourself and trying to visualize and so on, right? Robin Hanson wrote a great book on this called The Elephant in the Brain, and that book is sort of filled with these games that your mind plays with itself. Sort of the animal brain used to running away from lions which is useful for surviving lions, but it isn't useful for surviving exponential threats. And that's why, I think a lot of people they see the news, they're like, okay, it's going to come, but it hasn't sunk in, right? And then they're not taking action. And this is the key thing. So it's got to sink in by hell or high water. But even if it hasn't sunk in, then maybe just, say, I'm going to wash my hands. I'm going to get my supplies. I'm going to self-quarantine. I'm going to stay home from work. If it blows over, fine. Everyone is stupid. But if it doesn't blow over, then I'm good to go, right? And that's all about bounding the downside. So doing this stuff just in case, right? Get past your brain.
Yeah, exactly right. That's such a good way of putting it, Trent. The cost of preparing yourself and making some preparations, both physically, I suppose, and psychologically as well, and just preparing for not necessarily worst case scenarios, but preparing for what could happen in Italy. The cost of doing that is, there are costs, but the costs of not doing that could be far greater.
Exactly. Once again, bounding the downside, right?
Bounding the downside.
Yeah. It costs you, maybe a few $1,000 or euros at most to bound it, or less depending how cheap you are. Go and buy a couple big bags of rice, right? And potatoes and stuff, right? If you want to be cheap about it, and that's fine. And, rice, but other things too, of course, whatever supplies. And there's lots of great lists out there in this website, in this article that I wrote. I try to link I really try to gather as much information as I can from all the various experts and so on, and put it in one place. Interestingly, this sort of rational thing happens at an individual level, but also at a governmental level, right? So they've essentially got cognitive dissonance going on at that level too, right? Here in Germany, for example, have people talking about, we should really keep open borders, like politicians talking about open borders. And that's not helpful to the conversation right now, right? I'm all for open borders generally, but the first thing is we have to get through this crisis, and it is a crisis, so we need to get through it with maximum survival, right? And we can do it together. So that's probably the biggest thing to understand. And then, the advice, there's very specific things like sort of Pareto's law, like wash your hands, stay inside, don't go to work, all that. These can make a huge difference, right?
Bringing it back to this idea of flattening the curve, that's really what it's about. So it's about a little bit of shared short-term sacrifice for the longer-term greater good, really.
And then, the other thing, though, is a week from now, when, maybe if Germany or Berlin is really aggressive, they do manage to flatten the curve to not overwhelm the system. But let's say that they don't, and, there is a more than small probability that they don't, then we're going to have this overwhelming. What can we do then, right? How can we as citizens help then and there, right? And I think this is something that's not just going to be in Germany, but, it's happening in Italy right now, and China's sending supplies to Italy. I think that's wonderful, right? And it's going to be happening in America and all these other countries too. So things like scaling up, creation of tests, because even after the medical system gets overwhelmed, getting the tests, really aggressively testing, is super, super useful, right? The drive-through testing that Korea did, amazing, right? They had super aggressive testing, and that's actually allowed them to get things under control. As of today, Germany has 2 stations set up for drive-through testing, so that's, a nice ray of light coming into Germany, and hopefully that will get scaled up. But what about at-home testing, right? Where imagine everyone in Germany gets mailed tests, and then they spit into the vial or whatever it is that you have to do, 23andMe style, and then they send it off, and a day later it tells them whether they have the thing or not, right? That is that sort of thing can be super, super valuable.
Okay, well, I've said most of what I've needed to say. Trent, have anything else you'd like to share?
So I guess in terms of bounding the downside, right? I've talked about individuals minimizing the chance of getting infected, individuals bounding the downside if you do get infected, and there's a lot more detail in the blog post on that with the right links. There are bounding other downsides, given that this is a crypto crowd, then the financial downsides, there's things that you can do there. But I think at the heart of it, right, as individuals, it's have courage, right? Watch your brain, try to get in your way. And then all these same sort of advice for the government, sort of at a citizen level, right? Maybe I can end there too. I keep asking myself, what can I do to help? And the first thing, it's hard to help others if you can't help yourself. So it starts with that, helping yourself and the ones close to you. But then beyond that, what else?
Yes, indeed. And I think really, you've got to look after yourself as an individual and look after your friends and family as best you can. And, we're just going to have to see how this plays out at this point, Trent.
That's right. Bound the downside.
Yeah. Bound the downside, everyone. Bound the downside. All right. Well, look, I really appreciate you talking to us today, Trent, and thank you for your published contributions. And of course, links to those two essays will be in the show notes. Hey, thanks, Trent. And look, hopefully in another time you can come back and we can have a more positive conversation about some of the other things you work on. How does that sound?
Sounds great.
All right. Hey, thanks, Trent.
Thank you.
Okay, well, there you go. Thank you for listening to a slightly different episode of the Crypto Conversation. No Crypto Conversation hot take round, of course, for this episode. It just didn't feel appropriate. Links are in the show notes to that paper by Nicholas Nassim Taleb. I've talked about that a few different times on this podcast. It is worth a read if you haven't read it already. Also, links in the show notes to the two papers by Trent and that model, when does hospital capacity get overwhelmed in the USA and Germany. Yeah, look, you can check it out for yourself, but according to the model, that could be quite soon. Developments today, the World Health Organization have finally declared COVID-19 a global pandemic. Trump addressed the USA earlier today, and he has closed the border. Well, he's put restrictions on flights coming from the European Union to the US. I'm not going to say too much, really. This situation is changing rapidly, day by day. It does look more serious. So, look, be safe out there. This was the Crypto Conversation for Brave and New Coin. Stay safe.